Hi folks, Dr. Tom Meade. Welcome to another episode of Truth in Medicine. This one on the blockbuster GLP-1 obesity drugs. Truth be known, this is one of the main reasons I started this whole project. If you haven't seen the first couple episodes where I really go into an in-depth explanation of why I started this program, in brief summary, after 4 decades of a high-volume surgeon, I got a little tired of the misinformation in medicine I've heard from many venues, patients, families, practitioners. But most annoying is when I got home at night, I put on the TV and I saw these direct-to-consumer advertisements for obesity and diabetes where these actors were holding up one little pill and saying, this is all I have to do every day is take this pill. They sang these wonderful jingles. They're hopping around. They look happy. The problem is it was just unbalanced information. You never heard about the side effects until the end of the advertisement at what sounded like a 78 RPM record rattling off 15 or 20 side effects. Then you never heard about lifestyle changes. So before I start doing the show, I had to look at how we got here. 100 years of diabetic treatment did lead to the obesity crisis, an obesity crisis that in large part we caused. We, meaning the medical industry, the American Heart Association, the American Diabetic Association, all of the federal agencies, the U.S. Department of Agriculture, USDA, NIH, HHS, the Surgeon General, the Food Pyramid, presidential candidates, they all got in line with the same advice. That was the low-fat, eventually high-carb diet that was cardioprotective based on absolutely no evidence, but it persisted for 50 to 70 years. It was a major contributor to cardiovascular disease in this country. It caused obesity, metabolic syndrome, high blood pressure, lipid abnormalities. It did the exact opposite of what it was supposed to do. So basically, it was a problem that we caused, and now we're coming up with a solution, a blockbuster drug that may indeed end up being a $1 trillion business, the first $1 trillion healthcare business. So before, I did this show, I had to do some research, but I wanted to let you know that I am neither for or against GLP-1s. Actually, I recommend it for a lot of patients. What I'm against is the imbalance in advertising, the heavy hand on just all the pros, but minimizing the adverse effects, of which there are many. So this show, I really wanted to set out to give you a more balanced view of the GLP-1 drugs. What I wanted to do was go over what we know, what we don't know, so much good, a lot of bad, a lot of unknowns. Is this another drug versus lifestyle choice? It's not a new drug. It's been around for 40 years. And again, this, like many drugs, was not designed for the original purpose. So let me go over quickly the GLP-1 history, a couple historic benchmarks, if you will. It wasn't discovered till I was a resident, 1986. Never heard about it in medical school. So a lot of docs that are my age also don't even know how this hormone that's released in your stomach works. It only lasts for a minute or so. And so a lot of pharmaceutical companies said this could be a great weight loss drug, but if it only lasts a minute, it's not going to be a good drug. So ironically and serendipitously, about 6 years later, somebody, for some reason, was studying the venom of a Gila monster, and they found a very similar GLP-1-like molecule, but it lasted for hours and days and even weeks. And they said, this is what we need as a model for the drug. So it took another 13 years before the FDA and pharmaceutical companies figured out how to get this made into a drug that treats type 2 diabetes. What they found out is the secondary value is it caused weight loss. So another 10 years went by and it was approved by the FDA for a weight loss medication. The big breakthrough by Ozempic made by Novo Nordisk in 2017 was really their advertising jingle. Oh, 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 Ozempic. I'm not a great singer, that's why I'm an orthopedic surgeon, but that jingle rang very, very true. And that was a big reason for the success. The same medication, same molecule actually, they called it Wegovy, came out in 2021, which was a blockbuster, weight loss drug. And then other companies jumped on the bandwagon, and they even improved it. They added another gut hormone, GIP to GLP-1, that actually worked better, lowered the sugar more, achieved greater weight loss, but it had greater side effects. And then that was Mounjaro, and then their weight loss drug, the same molecule, tirzepatide, was Zepbound. And so the advantages in this GLP-1 drug race was greater than artificial intelligence. 2025, they came out with a pill because 90% of people didn't want to get the jab. They didn't want to have an injection to lose weight. So a pill came out, and this will expand the market even further. This year, 2026, they added a third hormone to the drug. Every time they add a hormone, it becomes more effective. It lowers your blood sugar more. It loses larger amounts of weight, but there's a higher side effect ratio. Remember, we are the fattest country in the world. We actually created, to a large part, this problem. Before I go any further, you have to understand, I have to understand how this works. It's called the mechanism of action. So a GLP-1 is a hormone that's released in your stomach after you eat. It does a couple things. It stimulates the pancreas to secrete insulin that lowers your blood sugar, but unlike insulin, you never become hypoglycemic. It slows the food movement from your stomach. It signals your brain to feel full. It stops that food noise. It suppresses the appetite. You feel full faster and longer. You eat less. So no wonder the pharmaceutical companies wanted to develop a drug like this. The problem is patients want a drug to fix a problem. They're overweight, they're obese. They say, I want a drug that just lowers my weight. The problem is, this is pleomorphic. That's a big word for it affects every single organ in your body, some good and some not good. In the way that it affects your brain, there are receptors in your brain, and it has a direct effect on that food noise that stops people from eating. It also has some other positive effects for addictive qualities, for medications, for drugs, for food. So there's a lot of beneficial effects. They also think it may have a neuroprotective effect for Alzheimer's or dementia. It has a cardioprotective effect. There are receptors directly in the heart. It has positive and negative effects on the pancreas. It releases insulin to decrease your blood sugar, decrease insulin sensitivity, but it can also cause pancreatitis, decreases fat stores. The gut, it perhaps has the greatest negative effect because that's where you get symptoms like nausea and vomiting. You can actually get gastroparesis or anilius, even gastric preparations. Perhaps the biggest negative is on muscle loss. And we'll talk about that in a little bit, but 20 to 50% of all the weight loss can be from muscle loss. It has a protective effect in your liver against fatty liver. This is not an unusual drug story. This is the many drugs are designed for one purpose, and they're found to have another purpose. In this case, it was designed for diabetes, but it was found to be a significant weight loss decreaser. So the secondary benefit is really one of the greatest marketing advantages for this type of drugs. There are other drugs that are very similar. Minoxidil was designed as a blood pressure medicine, but it caused hair growth, so it was for hair loss. Viagra was a blood pressure medicine that's now for erectile dysfunction. There's a whole bunch of medications that were started like this. Neurontin, gabapentin was started for seizures, and it's used for sciatic pain. But these GLP-1s are also an anti-inflammatory, so it's a combination win. It treats diabetes, lowers blood sugar, but it loses weight. This is not unusual. There is a lot of good of GLP-1s. They work. You can lose 5 to 18% of the weight loss with the original GLP-1s. If you add a second hormone like GIPs, you can lose 20% of your weight. The problem is You get higher side effects with these greater additions of hormones. Decreases hunger, decreases food noise, has cardio and kidney protective events. And like I said, it can be neuroprotective for dementia. What's not so good, it's not for everybody. It's expensive. Side effects can be 40 to 70%. 90% of people will have at least one adverse effect. And what they don't talk about is weight loss plateaus. Hunger can return after a year. The muscle loss we talked about. And 60% of patients over 65 stop after a year. There's more not so good. These are designed for lifetime. This is annuity for big pharma. It's a huge win. The side effects are long and serious. Like I said, you can lose muscle. Up to 50% of the weight loss can be muscle. You are weaker. You can regain 2/3 to 3/4 of the weight loss within a year after stopping. Most will regain a significant portion of the weight loss after stopping if they don't change their lifestyle. The general consensus among GLP-1 drug treatment, it's necessary to maintain it the rest of your life, to maintain all the positive aspects, including weight loss and the cardioprotective events. Many don't change what they eat, and they don't know the long-term complications. The common complications, tachycardia, higher heart rate, you can feel your heart beating. The most common ones are nausea and vomiting, diarrhea, constipation, infections, headache, indigestion, fatigue from muscle loss. The serious ones, pancreatitis, cholecystitis, intestinal blockage or rupture, thyroid cancer. This is a side effect, although small, that can cause thyroid cancer, acute kidney injury. Eyesight can affect diabetic retinopathy. You can develop antibodies. You can aspirate, and it changes your microbiome, which is all the bacteria, almost like another organ in our intestines. So what's easier? Is this drug versus lifestyle? For both the patient and the physician, it's easier for the drug. It's easier for the patient, it's easier for the provider, it's an easy injection, it's costly, and it's worth a lifetime. It's very, very hard to change your lifestyle. Eat less, learn more, less carbohydrates, but there's no serious side effects if you take the lifestyle approach. But some people have tried it for years and years, and this is a good option for them in the short run. So let's stop there, and we'll come back and we'll finish this story. We'll come up with how you win taking a GLP-1 obesity drug. Welcome back. We're talking about drug versus lifestyle. Some of the mistakes we made almost 100 years ago with insulin, we may be repeating now, where drug versus lifestyle has a lot of good, but it can contribute to a lot of bad. Just like insulin contributed to the obesity crisis, there are a lot of serious side effects with the GLP-1 drugs. So the solution now to treat the side effects is, as we spoke about, is to come up with other drugs or other treatments. So the pharmaceutical industry notes that we can have constipation, we can have diarrhea, we can have muscle loss. So their option is coming up with another pill they're working now, so you don't so you can take GLP-1 drug, take another pill so you don't have as much muscle loss. You can take medication for diarrhea, for constipation. So is that really the answer? But you have to weigh that before you start it. There is a dark side where athletes that are not overweight, they're abusing this drug so they can lose weight. Who would like to do that? Cross-country runners, cyclists, gymnasts, wrestlers. We're seeing it recommended for 12-year-olds, not unlike statins that are recommended for young children. It's very, very costly. It's not for everybody. It doesn't work the same for everybody. You know, I saw a patient today in the office, they had a BMI of 50. They took it for a year, they didn't lose 1 pound. The cost at $1,000 a shot is crazy. It will bankrupt Medicare and Medicaid. So we're seeing the price come down. But at that rate, nobody can afford it. They don't work the same for everybody. Everybody is genetically different. So we have to look at those aspects. Older Americans quit weight loss drugs in droves. 50% of patients, of all comers, stop it within a year, mostly because of side effects, costs, and they lose the advantage. Once you stop taking the drug, it's like Cinderella at midnight. Everything goes away. The weight comes back often higher than the weight you had before that. The cardioprotective event goes away if you gain the weight back. The neuroprotective events go away. So you have to realize that there's no free lunch. The pharmaceutical companies look at this as an annuity. They want you on this the rest of your life. But I have noticed that the commercials have become a little less. The FDA has clamped down on the excessive and the inaccurate advertising. They're taming the drug ads that we see on TV. How about body positivity? What happened to love your body? You're only as good as you feel. Well, as soon as this new medication came out, Ozempic chic is in, thin is in. We see celebrities looking like skeletons. And I see the same thing in my office. I see patients come in who their body in general looks a lot smaller. I compliment them, but they don't look as good. They don't look as good for a couple reasons. I have to say, mirror, mirror on the wall, before you start, these are some things that I have seen. Ozempic face, wrinkles, sunken eyes, thin lips, or bigger lips. If you've had your lips injected and your face gets thin, they look abnormally, unattractively big, sagging skin. My periodontist tells me about Ozempic mouth, Ozempic teeth, gum recession, loosened teeth. We see this all the time. Ozempic butt, you lose muscle, your skin is sagging. This is a windfall for plastic surgeons. Men hate hair loss. Women hate it more. Women come in and tell me they see their hair falling out in the shower. This prompts them to stop the medication. But the big thing is muscle loss and mixed libido. Some increase, some decrease. You can't always predict it. But one of the greatest things you can do for longevity is maintain your muscle mass. If there was one pill that would decrease your cardiac events, cancer, dementia, it's muscle mass. And we're taking a medication that decreases muscle mass, lean muscle mass. And ironically, even if you exercise while on these drugs, you will not increase your muscle mass the same as people working in the gym without these. So does this affect your longevity? We really don't know. But 20 to 50% of your weight loss can be from lean muscle mass, and it can shorten your life. So how did we get fat? We got fat by artificial means. And what do I mean by that? Well, 100 years ago, we didn't see the number of obese patients that we see now. 3/4 of the country is overweight or obese. We got there artificially. We got there by processed food. We got there by genetically modified wheat, genetically modified food, high fructose corn syrups, a lot of the foods that just weren't natural. So in some ways, this is exactly how we got there. So now what we are offering is to lose weight unnaturally. And this is by taking a drug that is not normal. Remember, the natural GLP-1 hormone that's released from your gut lasts only a minute or so. The new drug that you take lasts days or weeks. This is not normal. There has to be some long-term effects, and we don't know because it hasn't been out there a long time. So we have to be really careful taking these drugs for long periods of time. How do we win? Let me tell you how you win. First, we have to remember our two guiding principles. Will we live longer or will I live better? Well, we really don't know if you'll live longer. Maybe you will if you lose weight and you maintain that. But we may not, because if you lose muscle mass, that's one of the biggest predictors of a long life. So really the long-term risks are not known. So what I tell my patients is take it for the shortest period of time and use it like a credit card. So you win using credit cards if you use it for the shortest period of time and you pay it off monthly. You lose if you make a deal with the devil or the bank and you max out your credit card and you are stuck with a lifetime of high interest rates, paying it every month for the rest of your life. So GLP-1s are the same thing. I think, and I tell my patients, if they tried every other way to lose weight, these are really amazing drugs. I've seen some amazing things in my practice. I've had patients come in and they've been type 1 diabetics, they're on insulin, and this is not supposed to be a drug for type 1 diabetics. They started it for the first time in their life. They've decreased their insulin requirement by 1/3. They've lost 30 pounds, and they do have some side effects. So these are amazing things that I've seen, and these are from nurses I work with in the hospital. So the big win for the patient is take it for a short period of time. Take it 6 to 12 months, lose your weight, and then get off it. But if you don't know the root cause, or if you do not change your lifestyle, you are going to be one of those patients that gains all the weight and more back. You lose all of the cardioprotective events and all the other advantages of taking this drug for that period of time. So you win by taking it for that period of time, lose the weight, get off it, but completely change how you got there, how you eat, and your lifestyle. You have to do it permanently. I've had other patients come in my office and they looked wonderful. And I said, "You look great. How did you lose weight?" And they said, "Well, I tried the GLP-1 drugs. I've lost 30 pounds. And I always ask about side effects. How were the side effects?" They go, "Oh, they were terrible." And I go, "Well, what do you mean by that?" They said, "I've had diarrhea, I've had constipation, I've had headaches." And I said, "Was it worth it?" They go, "Oh my God, absolutely." So people hate their weight gain so much, they will tolerate some of these adverse side effects. So the greatest ones, again, are the GI side effects, but there can be more serious ones. So look forward to 2026. There may be pills coming out that are less expensive. There's a big push from the federal government that pharmaceutical companies shouldn't be gouging people for this, but don't let the pharmaceutical companies win. Don't take this the rest of your life. We don't know the long-term disadvantages, the long-term problems with this. Choose a healthier life. You're better off always getting off drugs as quickly as you can. Have a healthy lifestyle. So I hope this information has helped you. Join me on the next Truth in Medicine show. Thanks for joining me.